Imagine a world where food has lost its allure. Your favorite meal is placed in front of you, but it might as well be cardboard. So you can chew and swallow, but the joy of tasting is gone. This is the frustrating reality for people experiencing a juicier, the complete loss of taste. Loss of taste can be a deeply unsettling experience. It can affect your appetite and enjoyment of food, leading to potential nutritional deficiencies. Beyond the culinary impact, it can also be a sign of an underlying medical condition that needs attention. The good news is that most cases of taste loss are temporary and treatable. By understanding the causes and seeking timely medical advice, you can regain the pleasure of taste and protect your overall health. Let's delve into the fascinating world of taste and explore the factors that can disrupt this crucial sense. Taste, one of our five senses, is a complex process involving thousands of tiny sensory organs called taste buds. These taste buds are essential for detecting the different flavors in the foods we consume daily. These taste buds are located on small bumps on the tongue called papillae, which are visible to the naked eye as tiny, rough projections on the surface of the tongue. Each papilla contains multiple taste buds, each with its own set of sensory cells. Taste buds are not only found on the tongue, but also on the roof of the mouth, the back of the throat, and even the esophagus. This widespread distribution allows us to detect flavors from all parts of the mouth. When we eat, food molecules dissolve in saliva and interact with the taste buds. This interaction is the first step in the complex process of taste perception. This interaction triggers signals that travel along nerves to the brain. These signals are transmitted through a network of nerve pathways, each carrying specific information about the taste. The brain then interprets these signals as sweet, sour, salty, bitter, or umami, savory. Each of these basic tastes is detected by different types of taste receptors, which are specialized to respond to specific molecules. Interestingly, what we perceive as flavor is not just taste alone. The overall sensation of flavor is a combination of multiple sensory inputs. It's a combination of taste, smell, texture, and temperature. The texture of food, whether it's crunchy, smooth, or chewy, plays a significant role in how we perceive its flavor. When we chew, aromas are released from the food and travel up into the nasal cavity. These aromas are a crucial component of flavor perception. In the nasal cavity, these aromas are detected by olfactory receptors. These receptors are highly sensitive and can detect a wide range of different smells. This olfactory information is integrated with taste information in the brain, creating a unified perception of flavor. The brain combines these inputs to form a complete picture of what we are tasting. This integration creates the complex sensation we experience as flavor. The brain's ability to combine these different sensory inputs allows us to enjoy a wide variety of flavors and culinary experiences. Understanding this intricate interplay between taste and smell helps us appreciate why conditions affecting the nose, such as colds and sinus infections, can also impact our sense of taste. When the nasal passages are blocked, the flow of aromas to the olfactory receptors is reduced. This reduction in olfactory input can significantly diminish our ability to perceive flavors, making food taste bland or unappetizing. This is why when we have a cold, our favorite foods may not taste as good as they usually do.
In many cases, taste loss is temporary and resolves on its own. This can be a relief for many who experience it, as the sense of taste is closely tied to our enjoyment of food and overall quality of life. However, understanding the underlying causes can help manage and potentially expedite recovery. Common culprits behind this temporary loss include respiratory infections, sinusitis, allergies, smoking, medications, and nutritional deficiencies. Each of these factors can affect the body in different ways, leading to a disruption in the normal functioning of taste buds and olfactory receptors.
Respiratory infections, like the common cold and the flu, are among the leading causes of taste loss. These infections are widespread and can affect anyone, regardless of age or health status. These infections cause inflammation in the nasal passages, which can block the passage of air and odor molecules to the olfactory receptors, impairing our sense of smell and consequently our ability to taste fully. The congestion and mucus buildup can create a barrier that prevents the normal flow of air, making it difficult for the olfactory system to function properly.
Sinusitis, an inflammation or swelling of the tissue lining the sinuses, can also lead to taste loss. This condition can be acute or chronic, with symptoms ranging from mild discomfort to severe pain and pressure. Similar to respiratory infections, sinusitis can obstruct the nasal passages, hindering the transmission of odor molecules and affecting taste perception. The buildup of mucus and swelling in the sinuses can create a physical barrier that prevents the olfactory receptors from detecting smells, which in turn affects taste.
Allergies, particularly hay fever, can trigger nasal congestion and inflammation, leading to a diminished sense of smell and taste. Allergic reactions cause the body to release histamines, which can lead to swelling and mucus production in the nasal passages.
Smoking, too, can damage the taste buds and olfactory receptors, causing a gradual decline in taste sensitivity over time. The chemicals in tobacco smoke can have a toxic effect on the cells responsible for taste and smell, leading to long-term impairment.
Certain medications, including some antibiotics, antidepressants, and blood pressure medications, can also have taste disturbances as a side effect. These medications can alter the chemical balance in the body, affecting the way taste buds and olfactory receptors function.
Nutritional deficiencies, particularly of zinc, vitamin B12, and iron, can also impair the function of taste buds. These nutrients are essential for maintaining the health and function of sensory cells, and a deficiency can lead to a decrease in taste sensitivity and lead to taste loss. Ensuring a balanced diet and addressing any deficiencies through supplements or dietary changes can help restore normal taste function and improve overall health.
Section 4. When taste buds fall silent, unveiling the chronic offenders. While most cases of taste loss are temporary, some can be chronic or even permanent. This can be a distressing experience, affecting not just the enjoyment of food, but also overall quality of life. Imagine not being able to savor your favorite meal or detect the subtle flavors in a dish. For some, this is a daily reality. These chronic cases are often linked to more serious underlying medical conditions, such as neurological disorders, oral health issues, hormonal imbalances, and head trauma. Each of these conditions can uniquely impact the complex system that allows us to taste. Neurological disorders such as Parkinson's disease, Alzheimer's disease, and multiple sclerosis can affect the nerves responsible for transmitting taste signals from the taste buds to the brain, leading to taste loss. These diseases can cause significant disruptions in the nervous system, which is crucial for sensory functions. These conditions can disrupt the delicate communication pathways within the nervous system, impacting various sensory functions, including taste. The brain's ability to process taste signals can be severely compromised, leading to a diminished or altered sense of taste. Oral health issues such as dry mouth, oral thrush, and gum disease can also contribute to taste disturbances. The health of our mouth is directly linked to our ability to taste, and any issues here can have a significant impact. Saliva plays a crucial role in dissolving food molecules and facilitating their interaction with taste buds. Without adequate saliva, the taste buds cannot function properly, leading to a reduced ability to taste. Any condition that affects saliva production or the health of the oral cavity can interfere with taste perception. This includes not just diseases, but also certain medications and treatments that can dry out the mouth. Hormonal imbalances, particularly in conditions like hypothyroidism and diabetes, can also affect taste sensitivity. These conditions can alter the body's internal environment, affecting how taste signals are processed. Hormones play a role in regulating various bodily functions, including sensory perception. When these hormones are out of balance, it can lead to a variety of sensory issues, including taste disturbances. Imbalances in these hormones can disrupt the normal functioning of taste buds. Regular monitoring and management of these conditions are crucial to maintaining sensory health. Head trauma, especially injuries affecting the head or face, can damage the nerves involved in taste perception, resulting in taste loss. These injuries can be particularly devastating as they can lead to long-term or permanent changes in taste. The delicate nerves that carry taste signals can be particularly vulnerable during head injuries, and damage to these nerves can lead to partial or complete loss of taste. Recovery can be slow and uncertain, making prevention and protection of these nerves essential. Section 5. The hidden foes, rare but significant causes of addusia. While relatively uncommon, certain rare conditions such as autoimmune diseases and radiation therapy can also lead to taste loss. Autoimmune diseases such as Sjogren's syndrome and lupus can mistakenly attack the body's own tissues, including the salivary glands and taste buds. This immune system dysfunction can lead to dry mouth and inflammation, impairing taste perception. Radiation therapy, often used to treat head and neck cancers, can damage the salivary glands and taste buds, leading to taste loss. This side effect is particularly common in patients receiving radiation therapy to the head and neck region, where the salivary glands and taste buds are located. While these causes are less frequent than the others discussed, it's crucial to be aware of them and consider them as possibilities, especially if you experience persistent taste loss without any other identifiable cause.